They keep telling us the gadolinium is safe. It doesn't reside in the body and it doesn't build up and it's not dangerous and whatnot. But if that's true, then why have they come out with something even better that's supposed to be even safer? Well, hello and welcome to You and Me and Multiple Sclerosis. My name is Pam. I've been living with multiple sclerosis for 40 years, so I can't even begin to tell you how many MRIs I've had to have. And now that I'm dealing with cancer as well, they stick me in the MRI tube once in a while for that, because for some reason they think doing regular CT scans is dangerous and could actually cause cancer. But I had had concerns, as you can tell from an earlier video I did, which I will link below, that gadolinium might not be as safe as we think either. I have read articles that say that gadolinium resides in the body longer than we think it does, and anything radioactive that resides long in the body could cause all kinds of problems, I thought. So when I saw this news article about a new kind of gadolinium contrast enhancement that reduces the amount of gadolinium that is required to achieve the same result, I was pretty excited and I thought I ought to share it with you. Let's go ahead and look at that article together. And this article I saw just the other day, January 16, 2025, in Multiple Sclerosis News Today. Bayer's MRI contrast agent, effective with 60% less gadolinium. Data. Use of Gadoquatrane shows similar quality on MRI, may make MS scans safer. So there you go. Right in the title of the article is pretty much all we need to know. There's 60% less gadolinium, and that's got to be a good thing because they're learning that gadolinium does not actually leave the body as fast as they thought it did. So you can drink all the water you want to, it's still going to take a while to flush it out. And so if there's 60% less and you get the same results as far as contrast, if the doctors can still see what they need to see, this is a really good thing. But let's take a quick look at the article itself. Gadoquatrane, they say, a contrast agent Bayer is developing for use in MRI scans, is able to detect regions of damage and other disease-related features while using 60% less gadolinium, a chemical element used to enhance an MRI, compared with existing gadolinium-based contrast agents. That's according to new data from Quanti, a phase 3 clinical testing program focused on the use of Gadoquatrane in contrast MRIs. MRI scans play an important role in diagnosing diseases like multiple sclerosis and are typically performed routinely and repeatedly, as often as every few months to every few years, to monitor how such conditions are progressing and responding to treatment. While the contrast agent gadolinium, which is used in MS to visualize lesions with active inflammation, is considered safe in most cases, currently used gadolinium-based contrast agents can form deposits in certain organs. By reducing the gadolinium dose needed for imaging, Gadoquatrane could make contrast-enhanced MRI scans safer for patients. As a leader in radiology, we are committed to bringing forward innovations for the benefit of patients, including potential options to reduce the gadolinium dose. Constanze Diefenbach, MD, Bayer's head of radiology research and development, said in a company press release. Gadoquatrane has a unique structure that allows it to provide clear imaging with a lower dose of gadolinium, according to the company. This structure makes it effective in identifying and monitoring abnormalities in organs and tissues, supporting accurate diagnosis and treatment of disease. The Quanti program tested contrast agent Gadoquatrane in MRI scans. The Quanti program testing Gadoquatrane comprised 3 phase 3 studies: Quanti CNS, and there's the number, quanti-OBR, and there's the number, and quanti-pediatric, and there's the number, involving more than 800 patients from 15 countries. Quanti-CNS, central nervous system, I assume, focused on the use of Gadoquatrane for imaging problems in the brain and spinal cord, while Quanti-OBR imaged other body regions, such as the abdomen, pelvis, heart, and blood vessels. As its name suggests, Quanti-Pediatric enrolled children and adolescents with known or suspected problems who were scheduled for an MRI. Principal investigator Julian A. Lütkens, MD, of the University Hospital Bonn in Germany, called the program a key step in exploring a reduced gadolinium dose for patients in clinical practice. According to Lütkens, this is especially important for patients in need of repeat contrast-enhanced MRI examinations, as well as vulnerable populations such as pediatric patients. Lütkens noted that contrast-enhanced MRI is a key diagnostic tool and particularly important to help define the treatment pathway for patients potentially suffering from severe illnesses, including conditions that affect the central nervous system, such as MS. In the studies, Gadoquatrane was given at a dose of 0.04 millimoles, a standard scientific measuring unit of gadolinium per kilogram body weight. This is much lower than the standard 0.1 millimole gadolinium dose used with existing gadolinium-based contrast agents. Despite the lower dose, Gadoquatrane produced similar results in detecting and visualizing abnormalities in MRI scans the results showed. Indeed, Gadoquatrane met key goals for imaging quality and detecting lesions effectively, top-line data showed. The Quanti-Pediatric study also demonstrated that Gadoquatrane has a similar pharmacokinetic profile, meaning how the drug moves into, through, and out of the body in children and adults. The safety of the contrast agent was consistent across age groups, including infants and young children, and no new safety issues were reported. According to Diefenbach, Bayer is looking forward to sharing the data with the scientific community. We are very pleased with the positive top-line results of the Quanti studies, Diefenbach said. And based on their results, I think all of us with MS are pretty pleased too. And then quickly, let's just listen to a clip from Real Talk MS, which is another online podcast that I listen to that talks about this new development with the improved gadolinium contrast agent.
Gadolinium is a chemical element that's used as a contrast agent to better visualize MS lesions with active inflammation on MRI scans. Now, I want to point out that gadolinium is considered to be safe. After being administered, it's mostly eliminated from the body through the kidneys. Note that I said mostly eliminated. It's also been shown that trace amounts of gadolinium, which is a heavy metal, can form deposits in certain organs and may stay in the body for years. That's why Bayer has announced the results of 3 separate phase 3 studies involving 800 patients in 15 different countries. And results from these studies show that Bayer's new MRI contrast agent, called Gadoquatrane, was effective in providing clear MRI scans while using 60% less gadolinium compared to other MRI contrast agents. Using Gadoquatrane makes MRI exams safer, especially for people who require regular and repeated MRI exams, and that would include people with MS. So what can you do with this information? Well, when you go for your next MRI exam and the radiologist or radiology tech tells you that they're going to be using a contrast agent, you can ask if it's Gadoquatrane. And if it isn't, you can suggest that they look into Gadoquatrane for future use, as the dosage of gadolinium is 60% less, making it a safer choice.
Well, I think all of that speaks for itself. And as John Strum said, the next time that your neurologist suggests that you get an MRI, Ask them about Gadoquatrane and see if they even know what it is, or if they're going to start using it, or if they're going to recommend that it be used. Because I do think it will make the repeated MRIs that we have to do when we have MS, especially in the early years, it will make things safer for all of us. And as I said, any little thing we can do to keep ourselves healthy as long as possible, we need to do it. But that's all I have for you today. So until my next video, please do take really good care of yourself. And I'll see you again soon.